I want to move on to a question Amit Kara has asked. We've been focusing on identifying the patients with FH who are not diagnosed and figuring that that's a key first step, which it is. But Dr. Kara mentions that you can identify these patients, but frankly, many of us have had the experience, as has he, that sometimes it's just difficult to engage these patients. Just simply reaching out and saying, we think you might have FH. We think that should be a red flag for them, that they automatically say, oh, okay, what do I do next? But it's not always the case. So Dr. Kara would like to know, Kevin, maybe you can start. What are the strategies for just getting people more engaged, beyond just simply telling them you have a condition that is really potentially very bad for your health?
Yeah, well, it's a great question. And a shout out to Dr. Kira. Amit and I were residents together, and I know what an outstanding clinician Amit is. And if he can't convince patients, it highlights that it's really pretty difficult. I think part of the challenge here is coming back to some of the behavioral science obstacles I raised during the talk, is we have a real challenge where you have young patients, asymptomatic, probably feel fine, and then we're saying, you have a serious problem, you need to go on lifelong therapy. It's going to lower your risk of having bad things happen to you in the future. But we know that young people in general, and when I say young people, I mean, we could be talking about people in their 20s, we could be talking about children, and the time horizons are very different than for adults, particularly older adults. If I say, well, this may affect your risk of having a serious medical problem in the next 10 to 20 years, that's an eternity, particularly if you're 9 years old. And so inherently, it's a really challenging problem. I think some of the behavioral science strategies one might think about that might work well in adults probably won't work well in kids. So for example, I mentioned the use of defaults. Defaults are used in a lot of settings like retirement savings, where people probably want to do it anyway and they just don't get around to it. So if you do it for them automatically, they're perfectly fine with that box being checked for them. That's a totally different story if you're talking about my child who's 9 years old and putting them on a medication. Mm-hmm. And so I think it does require a much more intensive discussion, counseling, than the system is typically perhaps set up to provide. This is a situation where we think about sort of this continuum. Parents have to opt in to do this. And I think they're going to need a lot of encouragement. It's not something that you can just sort of automate in any way, shape, or form.
Thanks, Kevin. Mary, this issue of engaging patients, it's one thing when patients sign up to come see us in a lipid clinic, they've already sort of declared themselves as being interested. But this idea of searching the EHR, finding patients, then trying to engage them is challenging. I wonder if you, from your perspective as a clinician and also from your role at the foundation, I wonder if you could just speak to this challenge of patient engagement.
Yeah, thanks, Dan. I think that one of the big issues is a cold call. Patients finding out that, you were identified by this machine learning model, which is excellent at identifying people, and then getting what they view as a cold call. And one of the strategies that we're trying at Dartmouth is having that call come from their trusted physician. So I think that as Mr. Muller was saying, people trust their physician, they want continuity, and giving the primary care physicians, busy as they are, giving them the opportunity to really engage with that patient and be the one to prescribe the medicines, or just say, we've identified you, you might like to be seen at the lipid clinic. The other thing I would just point out is the children aspect. Kevin, you are 100% correct. When we see kids in the lipid clinic, we know that we need to see them 2 or 3 times before the parents are ready to engage in, yes, okay, my child will take a statin. So it is a process. And I think you have to gain people's trust before they're willing to take the medications.
Catherine, I'd like to maybe ask you to comment on this too, as a patient, and of course, as your perspective and having dealt with lots and lots of patients from the foundation point of view. This issue of patient engagement, and can I just add one other thing onto it, which is there's the engagement of the patient with regard to their own care, but then another thing that we've all struggled with is engaging them in the cascade screening part of it, and being a partner and reaching out to not just immediate family, but extended family to try to get, that has been super challenging. And maybe you could just comment on that issue from your point of view.
Well, I'd start by saying that I think most people in the United States do not have a very concrete idea of what heart disease is. I mean, there's a lack of urgency around heart disease in general. And then you add on to that the fact that you have a genetic condition that would make you vulnerable to heart disease decades sooner. And there is a lot to educate an individual on. And what we see is that they need more than the 10 or 20 minutes with their physician. They need to hear it from a variety of voices. They need to read it. They need to join social groups where they hear other patients who look and sound like them, their mothers, or they are someone who just recently had a heart attack and wish that they had listened to their doctors for decades. So I would just add on to what Ralph said, which is I think that the healthcare system needs to set up a structure to support patients along their journey. But where we currently are in the American healthcare system is it is so fragmented that patients, that burden often falls upon them and it is being filled currently by other types of organizations like the FH Foundation. And I see the social pressure, the social accountability that that these Facebook groups put on patients to go ahead and lower their LDL, to persevere and try another statin, or to feel comfortable to try a novel treatment. So I think we have to remember that individuals outside of the healthcare system are also very busy and need continual reminders and support. They need structure, just like physicians need to make good choices.